webinar because you know, it's not like being in a presentation where you can see people's faces and get a handle on who your audience is, but so there's definitely some drawbacks, but the great thing about webinars and being able to use this technology is that we can pull people together from all around the country without having to travel, and hopefully this is a convenient, good time for you, and that the software is working okay for you. So just to get started, my name is Mila Kelly. This is the Green and Healthy Tribal School webinar series, and it's part of a broader initiative to get technical and practical advice out to schools and tribal schools to improve their schools environment. As I said, I'm the coordinator of a program called Peaks to Prairies, and also the coordinator of an organization called the Tribal Pollution Prevention Network Work Group. And basically, we are, I'm part of Montana State University's Department of Extension, their Housing and Environmental Health Program, and we serve as a pollution prevention information center for EPA. And what that means is pollution prevention can be a little bit of a confusing term to some, but basically it just means that we work on educating folks on reducing waste at the source rather than controlling pollution through treatment or disposal. So for example, to use a school example, green cleaning is an example of pollution prevention because you're eliminating the potentially hazardous chemicals that you use right at the start rather than having to address the effects of a toxic chemical once it's been applied. So, you know, basically substituting a potentially hazardous product with one that is less harmful but functions just as well. So, so that's what I do. We're based out of Montana State University, as I said, in Bozeman, Montana. And this is part one of a series that we've put together. And as you can see on this list, and as all of you probably received, today we're starting with indoor air issues. We're going to talk about integrated pest management and green cleaning next week. We're going to talk about toxic chemicals in your school, doing school chemical cleanouts, PCBs, lead, and asbestos. We're going to move on to reducing your energy footprint, which we're going to talk about energy auditing and how you can do that within your school, within your community, and also about reducing your waste within your school. And then our final presentation will be on grant management, so how to write. So after all of these things that we've discussed, what are some tips on how to write a really great grant application and hopefully get some funds or some matching funds to help you implement some of these programs. And we are also putting these presentations together into a one-day workshop in Billings, which is June 16th. So if anybody is, you know, is interested in learning more about these issues, or if you know of someone who might have the opportunity within your staff or within your community that might have an opportunity to attend, that would be great. The workshop is free, and some travel scholarships are available, so you can just ask me for more information after the presentation. You can call me. You can go to our website, which is www.tribalp2.org, to register for the workshop, and you can also use my email, which is on this registration form. So just a couple of housekeeping notes before we get going. For everybody is muted, so we can't hear any of the participants talking. We can't hear your background noise or anything like that, so don't worry about that. And because of that, in order to ask questions, we need to type. You need to type your questions into the question pane, which is it should be on the right-hand side of your screen, and you should have a little a pull-down box that says questions. And if you click on that box, there's if you click on the little plus sign there, it opens up a question pane, and you should be able to type your questions right into that question pane, and you can send that privately to the organizers or panelists, or you can send that to everybody. So so that's how we'll try and have a little bit of interaction here. The other housekeeping note was that all of our presentations will be posted on our website probably tomorrow, so you can send that information on to other colleagues, send them the link, or you can refer to those presentations. They'll be recorded, so you can see just the presentation itself, the PowerPoint presentation, or you'll be able to hear the recording if you'd like to do that too. Oh, and one other housekeeping note I forgot to put on there was that for those of you from Montana, the Office of Public Instruction will provide credits for continuing education credits for those folks that are needing those, and we have your, we know that you, let's see, how do I say this? We have record of you if you're participating in this presentation or in all of the presentations. We know that you've logged on and that you've participated or been listening in to the call. So if you would like to receive continuing education credits from OPI, then just let me know and we can get that figured out. So I thought as part of just some of the interactivity that is possible with webinars, I'm going to try something out for my first time. And what we'd like to do is ask a couple questions to begin with and see if see sort of what your current state of knowledge is. So in order to answer the poll questions, you should be able to do that right on your screen. And so I'm going to start out with a question, which is, it should be up on your screen now. And unfortunately, I can't see the question itself, so I don't have it in my notes. But it should be, among all indoor air issues, okay, true or false? Okay. And you can change your answer. And I am just trying to find the question here. Oh. Okay, poll closed. Okay, among, this is not working for me. Sorry, you guys. Like I said, this is my first time with this technology, and it's not allowing me to see that screen. So I'm going to work on this, and maybe we can, what I'm going to do is move on to our first presenter. I'm going to try this out, and then maybe, hopefully, as our presenters go through, they will go through some of the answers to these questions that I was going to ask. So maybe I'll ask these at the end and see if we can.
Mila, we could see that answer.
And I know, but I can't see it, so I don't have the question in front of me. But you could see it. So amongst all indoor air issues, mold exposure causes the most deaths each year. Can you see the true and false?
Back, 53% of people said that was true, and 38% said it was.
Okay. Oh, you could see that. Okay. Yep. Is that what you see now?
Yep.
Okay. Okay. So true or false? Okay. So I'm going to go, and our next presenter will talk about these things in a little bit more detail. So we just want to, this is really for our benefit to see where you guys are at with this, with your current state of knowledge. Okay. Okay. Improving indoor air quality can improve student performance. True or false? %70 of you voted, 80%. Once we get to 90, I'll close the poll. Here we go, 90%. Okay, it looks like that was a pretty clear true. 100% think that indoor air quality can improve students' results. Okay. The most important step in setting up a basic tool for schools activity for a school is?
We're not seeing that, Mila, on the screen.
Okay, thanks, Katie.
Oh, now we are.
Appreciate that. Okay. To form a committee that includes parents, to distribute checklists, conduct a walkthrough through inspection, is good. This is good. It's finals week here at Montana State University, so I feel like we're all fitting right in here. Okay, 80% voted. Okay, let's see what everybody thought. And we'll go through some of these results when Ron is talking. Okay, so 56% think that forming a committee is the best way to get an indoor air quality plan going. 44% think that conducting a walkthrough through inspection is the most important step. Okay, and our last one that I'm going to ask you is that correcting indoor air problems in schools is important because there are no laws that protect kids from poor indoor air quality. True or false? All right. Great. Okay. All votes are in. Almost all are in. One more person. Okay, where are we? So most people believe that that statement is true, that correcting indoor air problems is important because there are no laws that protect kids from poor indoor air quality. Okay, thanks. Great. That's great information, a great place to start, and that gives us a good benchmark to work from. So right now I'm going to turn it over to Ron Schiller, who is the Indoor Air Quality Specialist for EPA's Region 8, which is a region that encompasses Montana, Wyoming, Utah, Colorado, North Dakota, and South Dakota. But for those of you outside of that region, he's got many colleagues throughout EPA if you've got specific technical questions, or we're happy to answer those too. And with that, I will go ahead and turn it over to Ron.
Thank you, Marla. Can you hear me all right?
I can hear you, yes.
Okay. I'm going to make sure the slides work here. Well, okay, I'll speak a little louder here. I'll start with what is indoor air quality. Indoor air quality, usually people think of indoor air quality as being just the junk that you find in the air, things like chemical pollutants, biological pollutants in the air, and that's partly true because you've got formaldehyde inside rooms from off-gassing of paints or carpeting. You've got air fresheners that are being used, colognes and perfumes. Okay, those are all pollutants. But indoor air quality also means you have proper temperature and humidity in a room or in a classroom. So an example of this would be when I was doing a walkthrough of a classroom, and this was in Utah in September, and it shouldn't have been cold there, but a couple of the teachers were wearing mittens indoors. So, if the teachers are cold, the kids are cold, they're not going to learn properly. So a good indoor air quality management plan controls indoor air pollutants, and it brings in enough outside air to keep the air fresh, and it maintains comfortable temperature and humidity levels. So how does Tools for Schools fit into that? Well, Tools for Schools, first of all, it's important to know it's a voluntary program. The EPA cannot force anybody to do it, but we would like to think that schools and schools administrators, that they would want to do something to help the kids and improve the air there. And it's also seen as a low-cost, no-cost tool. It's not something that's meant to bust the budget of schools. It's things that are just easy or no-cost fixes to improve the air. And it's in organizing a lot of the cleaning and maintenance activities that a school should already be doing. It's not meant to add a lot of extra work. It's meant more to organize what you're doing and just make it more, make you more organized. Tools for Schools is not intended to be a crisis management tool. I did get a call, this is several years ago, but a school asked me to come out to their school and give a talk on Tools for Schools, and I thought that's great. But when I got there, what I found out was that the school had an indoor air problem, and they didn't address it early, and they waited until it got to the point where the parents were angry, and there was a meeting at school where the news crews were there, and the parents were shouting, and Tools for Schools is meant to address problems before they become big problems. So once you've got a huge problem like that, Tools for Schools is not meant to be a crisis management tool. And there's a phone number there if you want to get a kit. They're free, and you just call that number, and you can get a free kit. And that phone number, I'll show it again later on here in the webinar. Just a bit on the history of Tools for Schools. About in the early 80s, well, the late 80s, the EPA and some other entities, we were looking at radon in schools. We thought maybe radon was a problem in schools. What we found, it wasn't just that radon was a problem, but in the majority of schools in the U.S., indoor air quality was really bad. It was affecting student performance. So the EPA, along with these outside entities, we developed the Tools for Schools kit. It first came out in 1995. And currently, about 50% of the schools in the U.S. either use the Tools for Schools kit or they're using an indoor air quality plan that closely mirrors the EPA guidelines for the Tools for Schools kit. And this is all the things that you will find if you were to order a Tools for Schools kit. And when you get it, it's about the size of a phone book. So I don't want anybody to be intimidated, because you'll find that with the Tools for Schools kit, it's adaptable. You only take from it, you only use what you need. So there might be a lot of things in the Tools for Schools kit that you won't even use, but just going over some of the things that it has, it'll have checklists, and the checklists are actually very nice to have, because an instructor, you say a teacher that has never worked with indoor air issues, you can give them a checklist, and they can just go through the checklist and say, yeah, I've done this, I've done these things, you know, keep out the clutter in the classroom. And if they go through that checklist, they're actually doing the things that an expert in indoor air quality would do. So having checklists is a really helpful thing, and it also helps you form committees and you have the problem-solving wheel. All these different things in a kit that might be helpful to you. You also have form letters to inform parents when there might be an issue. So everything that you might need when you develop a program, you can find it in this kit. So it's a nice thing to have, and just leaf through it and see what you need. These are the 5 basic steps in the Tools for Schools program, and this is one of the questions earlier, and probably the most important step of all of these is conducting the walkthrough, because you really can't help a school, you can't improve things unless you do a walkthrough of the school and you spot all the problems that there are that need to be fixed. But these are the suggested steps. And of these 5 steps, okay, the first one, forming an indoor air quality team and appointing an indoor air quality coordinator. I know a lot of people voted for that as a possible answer. The problem with this is sometimes I've been to some of these meetings where they have the parents come in, and sometimes these meetings go well and sometimes they go really badly. And I've seen them where they go really badly and the parents are angry, and it's very confrontational between the school and the parents. So having a team may or may not be a good idea. So it's something that it's up to you and the situation you're in. It may be that you just want to appoint someone and call them the indoor air quality coordinator, which is what this one school ended up doing, just giving it to one person and saying, please do this. And that person was the facilities manager for the school. Second step would be distribute checklists. It's always a good idea to give checklists out and questionnaires to find out where the problems might be in the school. I've already talked about the third step. The fourth step, prioritizing repairs. You know, what do you fix now? What can wait? You know, until you have more money in your budget. And the fifth step would be long range. Would be developing an indoor air quality management plan. Why is indoor air quality in schools so important? Well, first of all, we spend most of our lives indoor when you think about it. So you're exposed, you're outside. I mean, you're only outside a small portion of the time. You're inside most of the time. And of us, about 55 million Americans spend their days in schools. And this was another question, the poll question. There are no laws, there are no federal laws, and there are no indoor air standards that protect students or staff from poor indoor air quality. So if you work, let's say you're an adult and you're working in a factory, OSHA, Occupational Safety and Health people, they have laws and they have regulations that protect you and make sure the air you're breathing is safe. But children and school children do not have laws, do not have federal laws that protect them. So that's why, one reason why it's so important to have a Tools for Schools program to give those kids a little bit of a break. And the EPA has found that indoor air levels of air pollution can be 2 to 5 times or even more polluted than outside air. And here's some of the reasons. This is just to show how clutter can be in a classroom. And when you have too much clutter, what happens is the janitor can't come in at night. He can't make a proper cleaning of the room, so there's going to be a lot of dust, a lot of dirt in the room that gets left because it can't have proper cleaning. So you got clutter. This photo here is supposed to be showing mold. Because what happened here was the plants were being watered and they were being overwatered, and parts of the ceiling started falling down because you have mold. So mold and mold spores, they're an allergen, and they can also trigger asthma attacks in children. This is just a school chemistry laboratory sink and countertop. So this is obviously would be a bad problem, not just with indoor air, but all the chemicals that would be there. That was just, I pulled it off the web. It looked kind of funny. My daughter, when she was in the 2nd grade, she spent the whole year sitting next to a guinea pig called Caramel, and it's kind of cute to have them, but furry pets, they have dander, and dander is a asthma trigger, so it's not a good idea to have pets in a classroom. As much as the teachers and the kids might love them, it's not a good idea. Sometimes buildings are constructed wrong. Here you've got an exhaust and an air intake right next to each other. And sometimes buildings are modified so that the air handling system doesn't work. What happened a lot in the 70s and 80s was that schools deliberately blocked or shut off their air handling systems because they were finding that the more fresh air that was being brought indoors, it was costing them more to heat that air. So they wanted to stop that, so they would block off or they'd cover over the air handling units, and that is not a good idea because then there's no fresh air coming into the school. So you'll see that sometimes. And this is probably the biggest cause of all the air pollution or indoor air quality concerns and problems in classrooms, is because you've got all these kids breathing and they're taking up all the oxygen in the air. They're giving off CO2, so the more CO2 you have in the air, the more tired the kids are. Plus they sweat a lot, and so kids are actually a big source of indoor air quality problems. Radon, that was one of the questions at the beginning, and radon is actually the most deadly indoor air concern that you'll find. There's 23,000 lung cancer deaths every year from radon. Radon, it occurs naturally. It's something that happens when uranium in the soil breaks down. It gives off radon gas. What normally happens is that with radon, it comes up out of the ground and it dissipates. It goes in the atmosphere and it's not much of a problem. But if it comes inside a house or it comes into a classroom, the radon gas can become concentrated, and at high enough levels or over a long enough time, it can be a cause of lung cancer, or it increases your lung cancer risk. The 2 phone numbers I give there, actually the second one for tribes, it might be a better phone number, because I've talked to our Las Vegas lab, and they say if tribes call them, if they want to do some radon testing and they need some kits, you can call that second number and get, I don't know how many, it depends on their budget that day and how much they can afford to give you, but they can give away some free kits if you call them. So that's the EPA's Las Vegas lab. So that's that 702 number. That's a nice number to have if you're thinking of doing radon testing. And if you come up with a reading of over 4 picocuries per liter, then you should consider remediation. And that last bullet there, I just put that in and put that photograph in because I thought it was interesting that in Montana, people actually believe that it's healthy to sit in radon caves and expose yourselves to radon. This is not something that the EPA recommends, but some people believe that. So that's what that photograph is there. Carbon monoxide, this is a byproduct of when you burn a carbon-based fuel, so wood, propane gas, things like that, you're going to get carbon monoxide. And if your appliances aren't vented properly, you can get a buildup of carbon monoxide in a home. So it causes about 500 deaths every year in the U.S. The way you can protect yourself from this is to get annual appliance checks. You shouldn't use fuel-burning things indoors. So I think the common mistake with a lot of people is they'll use power generators indoors. So that's not a good idea. And you should buy a carbon monoxide detector. They're about $30, and they're available through Home Depot, Lowe's, or any hardware store. They're about $30 to $40. You don't see a lot of carbon monoxide poisoning in schools, but because the kids, usually if they're poisoned, they're at home more, so there's more carbon monoxide poisoning at home. But it's still something that you should at least be aware of, that if you get a lot of kids complaining about headaches and flu-like symptoms, it could be that they're being exposed to carbon monoxide and they're just getting some of the early symptoms of exposure. Volatile organic compounds. They can be built in a school. It can be unintentional, where if you've got new carpets or you've got new paints or cabinets and they give off that odor, that could be volatile organics. When you've got a new car and it's got that new car smell, that's actually volatile organic compounds, and it's not a good thing to be breathing in. One of the most common volatile organic compounds is formaldehyde, and formaldehyde has been, the EPA has declared that formaldehyde is a known carcinogen, so you don't want to be around formaldehyde. But volatile organics, they can also be intentionally introduced by bringing in air fresheners or scented candles, aftershave. So anytime you're using a product to try to cover up a smell, chances are it's going to be a volatile organic. So you're just introducing another type of air pollution indoors by using an air freshener. Volatile organics, volatiles they can trigger asthma attacks, and they can aggravate respiratory problems. Some other indoor air pollution sources, copy machines and faxes, they can give off ozone and particulates. Pesticides, you've got all kinds of chemicals that are used as pesticides, and they're meant to kill, so they're not good to be used indoors around kids. Cleaning products can have harmful chemicals, so we try to encourage schools to go towards green products. I think I talked a little bit already about perfumes and candles and room fresheners. They're actually, think of them as a form of air pollution. Air conditioners and swamp coolers that aren't running properly, they can actually breed bacteria. If you remember the Legionnaire's disease breakout back, that was 20, 30 years ago in Philadelphia, but that was caused by an air conditioning unit that was not draining properly, and it was breeding the bacteria in there. And with mold, I have given presentations just on mold, but I'll just say that with mold, there's been a 300% increase in lawsuits in the last 5 years, so it's a good idea if a school has a mold problem just to clean it up so they don't have to worry about the parents being up in arms and wanting to sue the school. So you're adding all these pollutants to a poorly ventilated, insulated box. Okay, and I just put this in here because I thought it was kind of cute. Okay, this child has environmentally induced asthma and attention deficit disorder. Even worse, he has a lawyer. That's what I'm talking about when I'm saying that parents sometimes they'll sue a school, or they'll force a school to take some action. Talk a little about the asthma epidemic. Asthma rates have doubled since 1980, and amongst the Native American populations, the rates are even a little bit higher than they are, higher than the general population. With the general population, 1 in 13 school children has asthma. At least that's the figures I've seen in most recent. And there are 10 to 13 million school days missed every year because of asthma. So tools for schools that can help identify and remove the common asthma triggers from classrooms. Here's some more reasons that schools should be concerned about poor indoor air quality. One would be the health and the morale of the staff. If you've got poor indoor air quality, the staff, they're not going to be willing to work that hard if they're not feeling that well. And poor indoor air quality and high CO2 levels, it equals lower performance. If you go to the EPA's website, you can see there's some studies that show a strong connection between high CO2 levels and students doing poorly, because when the CO2 levels are high, what that means is there's not enough oxygen in the air, and the children, they become tired and they have a hard time concentrating. So lowering the CO2 level to actually an ideal level in the classroom would be something below 1,000. But if you can lower it down to where there's enough oxygen in the air, you actually help students perform better. Another reason would be liability issues, that schools don't want to be sued. And the way my kids, how it works is if they miss a day of school, the schools, they lose a little bit of funding for that day when the students are absent. So you can't teach kids that are medicated or absent. So what are the challenges for the school? School and school administrators, they realize that you've got these problems in the school with indoor air, and they're not heartless. They would like to do something about it, but schools have these other issues going on that they need to take care of. Things like funding. They never have enough funds to take care of things like indoor air issues, or at least they believe they don't. Schools believe that test scores and student safety, student discipline, these are big issues. So schools have all these other competing interests. So indoor air quality, maybe that is something they're concerned with, but they've got these things that are taking more of their time, more of their interest. And also, why would you want to draw attention to an indoor air quality problem? So if you ignore the problem, maybe no one will notice. But tools for schools can help you address some of these concerns. If you improve the indoor quality, you can increase attendance. Increased attendance means more funding for the school. And if you can improve indoor air quality and lower CO2 levels, you can improve the learning environment and improve test scores through that way. And you shouldn't look at tools for schools as drawing attention to a problem. You should think of it as being proactive, that you're taking care of problems before the parents have a chance to complain about them. With tools for schools, one of the last steps would be when you're prioritizing your needs, you would decide what needs to be fixed right away. There's sometimes, and I could give examples of when I've done walkthroughs with schools where there's something very obvious and simple to fix. It might take 5 minutes to fix. Our contractor that works with us, they found that about half the fixes in a school and half the problems, they can be fixed within 5 minutes. So a lot of things are quick and easy fixes that can be done free. And there's some fixes that you might not want to do right away because it costs more money. So at least with the tools for schools, you can prioritize your repairs. And what do you do now? What are you going to do later on when you have more money? So you have an inventory of what the indoor air quality needs of school are. If you have a new school being built, that's a website that might come in handy. And for comprehensive Healthy Schools approach, this Healthy Seat it takes in tools for schools, but it also looks at asbestos in schools, chemical cleanout, pesticide use, all the indoor air, all the environmental issues that might affect a school. What the EPA did was try to put them into one CD, one software, so that a school can address everything, not just indoor air. So a Healthy Seat, and it's something that you can download for free or order for free. Who can help schools get started? If you contact the EPA, I don't know if you're in our region or another region, but every region has an indoor air quality person. They've got an indoor air quality program. You can contact the EPA and see what resources they have to help you. Here in Region 8, we've got a contractor that we hire, and we have them go out and help schools. There's no charge to the school districts. It's just something that the schools have to show some interest. The American Lung Association, sometimes, I can't speak for them, but sometimes they will help. Also state health departments, sometimes they'll help. State energy offices, this is getting a little more complicated because these are actually contracts that schools would enter into with an energy office, but this is also a possibility if the school has a lot of costs involved with improving their indoor air quality and they don't have the money to take care of it. And I put my number down there because if you've got questions afterwards or you think you might be interested, I could help you out. So there's my number again, and also the number again for the EPA Publications Warehouse. So if you wanted to get free publications on indoor air quality, just call that number and you can order them and they'll send them to you.
So Ron, if people want to order the tools for schools, they would call that publication number and just say, I would like some copies of tools for schools. Is that what the document is called?
Yeah, just say you want the Tools for Schools kit. You can either get a hard copy, and with those, they're about the size of a phone book, or you can get it on a DVD. I think with the DVD, there might be a thing or two missing, but either way, yeah, you call that, and I just talked to them a few weeks ago, and they still have them in stock. So you could call that number, and they're free. So take a look at it, and then if you think you might be interested, you could contact the EPA, and we could help you out in getting a program started.
Great. Well, thanks, Ron. I just want to encourage folks, if you've got questions, to please go ahead and type those into the question pane in your control panel. And just to get things started, I've got one question to start with, and I'm sure some more will come in. So you mentioned checklists in your presentation, and who is qualified to use those? Who do you recommend having, doing the walkthrough, I guess, or using the checklist?
Okay, it's two different things. The checklist would be given to any teacher or cafeteria worker or the janitor. The checklists are meant to help anybody that doesn't have an indoor air training. They can just go down a checklist and they can say, okay, I need to do this in order to improve the school. It's simple things simple steps they can take. So the checklist is meant that anybody can do it. So it doesn't have to be a trained person. It's just for the checklist, it's just anybody. And the janitor can go use that checklist, and they can be doing things to improve the indoor air. With the walkthrough, that's more someone that, let's say a school district or a tribe wanted to do walkthroughs and wanted to do the program. If they contacted the EPA, we could have our contractor go out there, and they've done it with school districts on and off reservations where they'll do a little hand-holding. They'll go through the school and they'll show exactly what to look for, what to do when you do a walkthrough. So that takes a little bit of training, but like I say, that training is free.
Great. That's a good segue. Just to be clear, one other question is, can you send someone to assess my school at no cost?
We could, but I know the contractor, they're given a fixed amount of dollars every year, and they have to do so many inspections with that money. So the best way to get the contractor out there would be to say, we've got an entire reservation or an entire district of 20 schools that would like to enter the program. Would you be able to come out and help? That would be more likely to happen than if you said, I've got one school or I've got two schools and we're in the middle of nowhere. Would you be able to send someone out? I don't think the contractor, it wouldn't be cost effective for them. The more schools that you could sign up and get interested in the program, the better it would be.
Great. And I'm just going to ask one other question, and then we're going to turn it over to our next presenter. Does Tools for Schools address asbestos and lead?
No. No, we don't.
So that would be the Healthy Seat.
The Healthy Seat would be the program that would address lead-based paint, asbestos, pesticides, all those other issues that a school might have.
Great. Well, if there's any other questions as our next presenter is talking, please do type those in. Ron will be with us the whole time, so if we've got questions, time for some questions at the end, we can go ahead and ask you some more questions, right?
Yep.
Okay. All right. Well, thank you very much, Ron. Right now, I am going to turn it over to Katie Loveland, who works in Montana, and I'll just, Katie, are you out there?
Mm-hmm. Yep.
Okay, I'll just have you do a quick introduction and go ahead and get started.
All right. My name is Katie Loveland. I am the program manager for the asthma control program at the Montana Department of Public Health and Human Services. And I'm going to be talking today about sort of a rural state's perspective on addressing asthma and indoor air quality in schools, especially some of what we've learned from working with tribal schools. So here we go. This is walking up. It's not working. Well, here we go. So first, a few stats about asthma in Montana youth. We know that asthma is a really common disease. Ron talked about that. It affects about 17,000 children in Montana. 6.3% of children aged 0 to 18 and 10.4% of high school students in Montana report that they currently have asthma. So, in a typical classroom of 30 students, you might expect that 3 of them would have this disease. So it's really the most common chronic illness in schools, and there's good research that shows that asthma does affect school attendance and performance, especially when it's uncontrolled. But a lot of what we talk about when we work with schools is that really with some simple steps in planning, it can be controlled in the school setting. So some data on American Indians and asthma. Montana does have 7 reservations in the state and 12 tribal nations represented. So for those of you from Montana, you know this slide well, but that kind of shows the outlay of the reservations in our state. So very important group in our state. 11.4% of students in Montana public schools are American Indian. And there's a higher rate of asthma among those students, so about 10.3% of American Indian students, as opposed to the 6.3% statewide report current asthma. And we know that smoking and environmental tobacco smoke exposure are just of greater concern in tribal populations. There's a higher rate, over double the rate of smoking among adults who are American Indian in the state of Montana. So what is asthma? Just briefly, it's a chronic disease. It's not something you cure, but we really talk about control for asthma. So if you look in this lung on the screen, someone who has asthma has more swelling inside of the airway, and that's kind of going on all the time with the disease. And then if they're exposed to environmental trigger, that trigger can cause that smooth muscle around the airway to clamp down, and that's when we say they're having this asthma attack. So that's that muscle tightening around the airway. So controlling asthma, some things need to be done at the doctor's office, getting folks on proper medication, getting them the right education about managing their disease. But then in Montana and in most states in this region, you can self-carry on the right here, this albuterol inhaler, the rescue inhaler. So once someone is on that medication, students can self-carry that medication, and it's really life-saving medication. They need to have it with them or accessible at all times in the school setting. So even though medical management is important, it's important also for schools to be aware of allowing students access to that medication in schools. And then what we're talking about today is environmental control, so reducing exposure to things like diesel exhaust, chemicals and cleaners, even things like cold air, pet dander, tobacco smoke, and allergens that can exacerbate asthma. So we've had a wonderful partnership with Carlene Gandara, who is a member of the Northern Cheyenne tribe here in Montana, and one of the main things I want to show you today is this video that is her story, really talking about her experience with asthma over the years. So we'll listen to this.
Hi, my name is Carlene Gondera, and I'm going to share my personal story about having asthma. When my mother was carrying me, she smoked, and she had me at 30 weeks. And when I was born, I weighed 3 pounds, and I'm a survivor. They didn't think I was going to make it because of because of weighing 3 pounds. I was in a hospital most of the time due to her smoking. I didn't discover asthma until I was 21. I battled asthma throughout my childhood, wheezing in and out of the hospital. Nobody knew what was wrong with me until I moved away from the reservation. Didn't know I had asthma until I moved away. I always wondered why I was in and out of the hospital, and I always fainted a lot, I wheezed a lot, and nobody knew what was wrong with me during my childhood. But when I moved away from the reservation at age 21, I had a severe asthma attack, and the doctors then discovered it and told me that I had asthma. Had no clue what asthma was, had no idea what it was, and he told me it was a lung disease due to smoking, and asked me about my childhood, and he put me on a medication called Dept, which is almost unheard of today. And I continued battling asthma from there on. He said I was a survivor and amazed. He was amazed that I survived during my childhood. And as an infant, I can't be around secondhand smoke or even around anybody that has just smoked. I go right into an asthma attack. There's other factors to it also why I have asthma attack also. I'm on 4 different inhalers. I'm also on allergy pills. I'm also on that Loveland yet. And I have my own machine also that I have to use every day. I come to realize how secondhand smoke can damage lungs and damage people. And my heart goes out to the little ones and to the pregnant women that smoke because I know what the children are going to go through. I also know that when mothers smoke, that it can damage the children's lungs, the baby's lungs also, and parents don't realize that. And I myself want to get that message out to the people. People think that you should be making all kinds of loud noise and wheezing and everything when you go into an asthma attack. For me, half the time I don't even wheeze anymore. I close off at the chest and my lungs, my airways close off. And nobody even knows that I'm having an asthma attack, except for me, because I'm very tight at the chest. And people can sit there and look at me and think that there's nothing wrong with you, but yet I'm grasping for air. For me, it's like somebody suffocating me. It's like someone choking me, because I'm grasping for air. I can't lay down. When I'm tired, I can't lay down. I have to prop myself up. A lot of times I'm walking around. Just for instance, like last night, I was up walking around most of the night. I didn't get to sleep until 5. Tried to lay down. I just, like someone was suffocating me. I also lose a lot of sleep due to having asthma attacks. I'm usually up most of the night. And then when I get up, when I do go to sleep around 5 till 7, I have to get up and go to work, get ready for work, and then I'm tired all day long. When I'm at work, I can't be around paper dust. I can't be around someone with cologne or spraying cologne, hairspray. If someone comes in and janitors come in and mop, the pine saw, the Clorox, even the weather. Or if they turn on air conditioner, I can't be around it too long. So I almost feel like I have to be in a bubble, and people don't realize that, and my supervisors don't understand that, my coworkers. Like I said, I miss a lot of work. I would say I miss sometimes weeks at a time, sometimes 3 days out of the week. There's times I'll go to work, but I'm grasping for air. I still go to work. So, yeah, it's tough. And I've even had a supervisor say, well, why didn't you let me know when you're going to have an asthma attack? And I really feel the society is very ignorant of asthma. They don't really understand, because we can be sitting there looking normal and not a thing wrong. People think there's not a thing wrong with us, but yet we're grasping for air. And nobody will understand unless they go through it. For me, the future is that there's a new shot out there. It's twice a month, but it is very costly. But it's a new drug, and I'm willing to try anything at this point. At my age, at 56, you're willing to try anything. I had an aunt that passed away due to asthma, and my heart, again, goes out to the people that are around secondhand smoke. So the best thing to do is stay away from secondhand smoke and keep your homes and your cars smoke-free.
All right, so that's Carlene's story. Really powerful. I think it gets to a lot of the issues with asthma, that it's a really serious condition, and that when you have someone at the level of Carlene with very, very severe asthma, that she really does need to be accommodated. She's having a severe disability, and it really is related to our environment. Other folks have more mild asthma, and it has to do more with just exercising. They might need to be accommodated in gym class, but you can see the level of where Carlene talks about her aunt dying of asthma. That does happen, and so that's when schools really need to be aware and really need to focus on their environment to help protect the health of those kinds of students. So some special challenges that a lot of you, I'm sure, have if you live in rural areas. Montana has 429 separate school districts. Most Montana schools are very small. 69% of schools in Montana have less than 500 students. So that also means they have few janitors and custodial staff. There's a real emphasis on local control in Montana, which is a good thing. Local schools get to make decisions about what's happening in their facility. But there's not going to be a mandate coming down probably anytime soon in Montana saying that you have to do work on indoor air quality. And then tribal schools have their own unique perspective and needs, and even different laws that apply. In Montana, we have a Clean Indoor Air Act that prevents secondhand smoke exposure in public places and also deals with schools. But in the tribal areas, those laws don't always apply or apply differently. And you guys know the unique situation in each of your areas. And Ron talks about this too, but interventions really have to be low or no cost, and the manpower required has to be minimal. I really like tools for schools. I think it's a great tool, but for schools in Montana that have 20 students and 2 or 3 teachers, forming a committee on indoor air quality may or may not be feasible. So in Montana, we have a really great consortium and support for asthma work from our Department of Ed and the School Board Association, the school administrators. We call ourselves Montana Team Asthma. And we've developed some resources drawing from things like tools for schools and others, but that are a bit more simplified and Montana specific. So we've created a resource guide on asthma-friendly schools. We've done 2 surveys of all the school administrators in Montana, one in 2008 and one just completed a few months ago. We provide free in-person trainings to school staff, and we focus on school office staff because of the lack of school nurses in Montana, and that office staff also often get stuck with doing some of the medical work or the medication work or responding to health emergencies. We also provide mini grants to school nurses, and we've created a new website, www.asthmamontana.com. That video that I just played is directly from that website, and it's focused on schools and child cares, and it has free training for schools. It has OPI renewal units attached to the asthma training and the coaches training. So that way, as a rural state, we can send these links out and reach a wider audience instead of going one by one to all of these 429 school districts. So we focus on 7 key messages for asthma-friendly schools: identifying students, allowing them easy access to their inhalers, having a protocol for handling worsening asthma, identifying and reducing common asthma triggers, which we're talking about today, enabling students to participate in activities even if they have asthma, that's the exercise piece, doing education about asthma, and then really focusing on the collaboration. You know, in rural schools, you can't expect one person in the school or the principal to be in charge of all this. It really has to be a collaboration, and families and students are key, as are the health providers in your community. So this is just a few quick results from some of the surveys we've done. In 2008 and 2011, the darker bar, there's 2011. You can see that we've increased the percentage of school administrators who agree or strongly agree that asthma is a serious health concern at their school. About 62% of administrators now say that in 2011. But a lot of administrators, and it's funny, maybe as their awareness has been raised about asthma with our work, fewer administrators now say that they're adequately prepared to handle it. I think it is a scary situation, especially in a very rural school, to know if you're really ready to handle it if you have a student who has a serious attack. About 59% of administrators say that they or one of their staff has received a copy of our resource guide. In the last 3 years, about 23% say they've actually received training on the resource guide, either themselves or their staff. And then of those who received the resource guide, 43% say they have used it to change some sort of policy or procedure related to asthma in their schools. So we survey them about our steps that we talk about. I think a real basic one is just having that process to identify students with asthma and collecting the self-carry form that allows students to follow Montana law and self-carry their inhalers on their person and really protects your liability as a school. And still there's a quarter of schools that really don't feel like they have a good process to identify students or are collecting that self-carry form. So that's an area we work on. Moving to what we're talking about today, I think another big area where there could be potential improvement is for schools to have that process to recognize and reduce common asthma triggers inside and outside of the school, and only 41% of administrators feel like they have that process in place. Also, our big focus of ours is training. You know, only 44% of schools say they provide some sort of training for their teachers or other staff. And then it's interesting because, you know, what, 60% of administrators say they have their schools adequately prepared to handle asthma, but only a third say that their staff has really sufficient training on how to handle it, and even what to do in their own classroom or in their own environment. So that training piece, there's definitely room to work. So focusing on our step 4, what we tell schools, you know, our resource guide on each of these steps really only has 2 pages of writing, but it really does direct people to the resource available in our state. So what we tell folks is, first and foremost, to know your school and your students. Each student's asthma is going to be really different. It's just, to me, I kind of think of it as peanut allergy. You know, you're not going to have a peanut-free school if you don't have a child with severe peanut allergy. But when you do, it's life-threatening, and you need to respond in kind. And so you need to know who has asthma and then really help them work with you to let them know their triggers. You know, Carlene talked about paper dust and pine sol and Clorox. You know, she had a laundry list, but other students may only have 1 or 2 things. They may have allergic asthma and really need to get the classroom dog out of the class, but they may not. And it may only be exercise-induced. So really knowing individually what your school needs based on what your students' needs are. And then focus on the triggers that are most important in Montana. You can get a lot of materials about asthma that are really national materials that focus on things like cockroaches and dust mites, which are somewhat can be present in Montana but are much more rare than other things. We have to focus on things like even wildfires, and when those are going on outside of your school, do you hold track practice or football practice? So it's important to know the triggers that are in Montana and that are affecting your schools. So our resource guides are free. I would love to provide you with one. And we just have one page that really kind of covers some of the the things that we think are key asthma triggers in Montana and some of the policies you might consider. There's a program at our Department of Environmental Quality about reducing school bus idling. Our tobacco program has wonderful resources on enacting a comprehensive tobacco-free school policy, so really making sure that kids are never exposed to tobacco smoke in school. Again, if needed, thinking about that pet-free policy, it's interesting how many trainings we do in schools in Montana that have pets that have in the classroom, and that's okay until that pet is a threat to a child's health. Pest management, there's folks at the state here that we'd love to direct you to that are really focused on integrated pest management. So if you're having rats or mice or, God forbid, cockroaches in Montana, there's ways to deal with those pests that don't involve the use of really toxic pesticides or use of those pesticides in a really limited manner that's still very effective but doesn't jeopardize the health of your students. I really think odors and sprays are a big deal in schools, and thinking about those policies that we could help provide you on having the odor and spray-free policies. Cold weather is a big one in Montana. We have really some simple things about, paying attention to when it's really cold and that can exacerbate asthma, and helping kids get the proper attire and warming up for athletic events outdoors. With allergens, we have some simple recommendations about knowing when pollen levels are high and making sure the windows are closed, looking at the foods that are served, and even things like arts and crafts projects and other chemicals that people can be allergic to. And looking at your HVAC system and working with your janitorial staff to know how to inspect that and make sure that that your air quality is good and optimal. That you're optimally using that HVAC system. And then we talk a lot about the fact that when kids get colds, that's a big asthma trigger. And so the idea of making sure that kids are encouraged to get their flu shots, to wash their hands, and just use proper etiquette when they have a cold is important. So it's a lot more basic, I think, some of what we have, but we do also direct people to use tools for schools when they have a more comprehensive, the ability to use a more comprehensive approach and the need to use it. So another thing that we do for indoor air quality is to provide money to school nurses to assess their school environment. So on that Asthma Montana website, we just opened it up again this year. We have $10,000 available for school nurses, and they can choose one of 5 projects. So some of them are things like going into the home of children to do environmental assessments. They can do training for staff, but a really neat project that I think a lot of them will be utilizing this year is this idea of assessing the environment. And so we have a 1-page front and back school checklist that the nurses use to look at the policies and procedures. They are supposed to interview a janitor and an administrator and take some notes about what policies are in place. And then they compile their findings and give those findings to a school administrator or give it to the school board or some sort of presentation to policymakers at the school level. So I would really commend any of your schools in Montana that have school nurses, even if they just work really part-time or are from the county or health department or from Indian Health Service. These are great projects. We give $500 to $1,500 out to the school nurses, and this might be a great way to start looking at your policies and practices around your indoor air quality. So I'm going to really wrap up quickly here. We have free resources and training on this asthmamontana.com website. You'll see we have school and coaches trainings, so you can click right on there. There's professionally developed videos and resources with a pre-post test, and they get OPI renewal units for doing those presentations. Carlene's video is right there on the front page at the bottom, so we encourage you to share that with others. The school nurse mini grants can be located right here, and how to apply for those, and then some information about child cares in schools. But please utilize this website. It's free, and we provide you with free resources when you complete the training. So utilize our resources, do an assessment, potentially through the school nurse mini grants or with tools for schools, and think about, start small, simple steps that you could take to improve your school environment. Know your setting and the uniqueness of your students, and definitely think about utilizing the more comprehensive resources like tools for schools if it is feasible for you. And please feel free to contact me. We are a state-run program. Many other states do have asthma programs as well, so if you're out of state, you might look and see if you have a funded asthma program in your state that might be doing very similar work to us. So.
Thank you, Katie. A couple of questions. Do you see any movement, just like children are now often or usually screened for vision, dental, hearing, do you see any movement towards doing more of a blanket screen for asthma around the country?
You know, the CDC really doesn't recommend doing asthma screenings for a lot of reasons. But they do recommend that if schools see children that seem to be struggling, if they can't exercise, this whole idea of this, I'm sitting on the sidelines at gym or or I can't be involved in athletics, that they really refer the student to a healthcare provider and talk to the parents and say, hey, something's not right here. And then I think if a student has known asthma and they're having a lot of trouble in school, they're missing a lot of school days, they're not in control. Something can be done to really help that student get a lot better control of their asthma. So that's another thing that the school, I think, can alert a healthcare provider or a parent to say, hey, something's wrong here. If they're missing, a day of school a week or a few days a month, this shouldn't be happening. We need to better control this disease.
Great, thank you. And another question: do you think that some of the new smoking laws around the country and in Montana are helping to lower children's exposure to secondhand smoke?
Certainly. I think the fact that now in Montana you can go to any restaurant, any casino, particularly those off of reservation areas, and not have that exposure to secondhand smoke is huge. But we know that a high percentage of Montana children and adults still report that someone has smoked in their home or in their car recently. So we just did a whole campaign using Carlene to do radio ads and doing direct mailings to families with asthma saying, hey, take that smoke-free home policy and that smoke-free car policy. And I think what the school can do by enacting a really good comprehensive tobacco-free school policy is really set that expectation. I mean, you guys remember when there was smoke-free, the smoking area of the plane, where my mom, who's a nurse, talks about how doctors used to smoke right by patient bedsides, and we've totally changed that cultural norm. And when the school has a firm policy where kids do not see anyone smoking, they're not exposed to tobacco in the school, then when the kids go home and see that in a car or in a home, they know something's wrong and can help their parents come around to the idea that, hey, we need to have a smoke-free home and a smoke-free car as much as possible. And that's where the exposures are happening now. But schools with their policies can help perpetuate that change in social norms.
Great, thanks. And just to wrap up, your presentation will be posted on the Tribal P2 website, and those links we will post. And so on that presentation, the links to your resources will be there. But what about if folks want to order a hard copy of that great resource that you've put together? What would be where should they go to order?
Or I would call my phone, and that'll be on the links all over on that asthmamontana.com website.
Okay.
Too. My information is all over there, and all you have to do is send me a link. We can get you 100 resource guides. We can get you the DVDs of our training and of Carlene's story, and we have some student stories as well. So all of our resources are free, and we'd be happy to get those out to you.
Great. And can you send those out of state too? Is that possible?
Yeah, I mean, out of we have to be a little more careful, but as long as it wasn't a huge number, we could definitely provide those resources to folks.
Okay.
And the electronic version of the resource guide as a PDF is easily accessible on the website as well.
Great, great. Okay, well, thank you very much. I just want to wrap up our presentation with one last poll, so hopefully this will work. And just ask you if anyone on the webinar is planning on taking any action on any of the items that we mentioned today. And this is just really for us to help us decide if we want to follow up with you, and if you would like to follow up with us. Any of the folks on this webinar would be happy to refer you to the right person or get you to the right person. And with that, I will close up our poll. Oh, and I don't know if you see that screen, but it looks like many of the folks on the webinar are going to, 50% are going to take some action on some of the items we mentioned today, which is great. Some of you need help, and some of them you're going to pass the information on. One person's not interested. So thank you very much. I appreciate all of your time and listening, and we look forward to our next session, which is improving your school's air through pest management and through green cleaning. And with that, we'll wrap things up. Thanks, presenters.